Good afternoon, everyone. Folks can take their seats. I think we'll get started. So I'd like to welcome everyone to this joint session of the Center for Humanitarian Health and our Center for Public Health and Human Rights here at the school. We're going to be talking together and learning more about this health crisis in Venezuela. I'm Chris Beyer. For those of you who don't know me, I'm the director of the Center for Public Health and Human Rights here at the school, and also associate director of our Center for AIDS Research. And as you're going to hear, there's an important HIV/AIDS component to this crisis. And one of the people on our faculty in the School of Medicine who you'll be hearing from momentarily is also very involved in the CFAR, Kathleen Page. So we're joined today by a wonderful group of researchers, clinicians, and advocates who have been working on the crisis. And I'm going to introduce you to them. But just before we do that, I want to just make a very few brief framing remarks, because I think what is happening in Venezuela is so important for all of us to think about and understand more about. And the first thing to say is, of course, that Venezuela stands, unfortunately, as a reminder about how vital it is to have good governance. This is an upper middle income country that was a vibrant population with a democratic form of government. It was very much, it's a beautiful country and a very resource-rich country, and it has among the largest oil reserves in the world, more estimated or proven reserves than Saudi Arabia, for example. And yet, here we are having a session in which we're going to talk about recrudescence of vaccine-preventable diseases in children, malaria epidemics, malnutrition, hunger, and out-migration from this country of people actually going to Brazil, to Colombia, to other countries in the region, seeking healthcare, seeking food, seeking security. So good governance is really at the core of this problem. And that is why, actually, our center and the Center for Humanitarian Health here initially got involved. Diedrick Lohman, who I'll introduce in a moment, who's heading up the health program at Human Rights Watch, reached out to us a couple of months ago to say, could you help us with the science, with the public health aspects of saying, is this health crisis reaching the level of a humanitarian emergency? And if so, does that change what might, for example, be done at a regional level or at an international level in terms of interventions and advocacy? So I want you all to hold on to that question. Is this a humanitarian crisis? And we're going to talk about what that means and the implications of it, and also the potential interventions that might make a difference. So we are really delighted and very grateful that we have a distinguished Venezuelan economist with us, Dr. Gerver Torres, who is going to open it up and explain, and we've given him very few minutes to talk about 20 years of modern Venezuelan history, how this relatively wealthy country could have been brought in these last few decades to this crisis point. He is an economist by training. He's currently at the Center for Strategic and International Studies. He has been a member of the board of directors of the International Monetary Fund. He's been a consultant to the World Bank and the Inter-American Bank. He's provided technical assistance throughout the region and in the Middle East. And very importantly, he served as Minister of Privatization for Venezuela. He also is the director of Leadership and Vision, which is a Latin American non-governmental organization dedicated to training leaders and formulating long-term visions for countries in the region. And so without further ado, please, Gerver.
Thank you. Thank you to all of you, to the Center for Humanitarian Health for putting together this panel, which could allow us to talk about the Venezuelan current situation. Paul has put the question very well. How could that country that once was one of the most prosperous countries in the region, in Latin America, has come to this terrible, indescribable situation? And I'm going to try in a few minutes explain what happened in Venezuela in the last 20 years. So it's not that difficult, you will see. In 1999, so roughly 20 years ago, a populist guy, a former military official, won the presidency of Venezuela by deploying a campaign, a populist campaign, of course, full of incendiary and very divisive rhetoric. He took advantage of a situation of social discontent, widespread social discontent in a country that had experienced 2 previous decades of not that good economic performance. So very soon, he started dismantling all democratic institutions. He took control of all branches progressively of the state. The system of check and balance was destroyed. And progressively, the regime became a very authoritarian, militaristic, socialistic, statistic, and a violator of human rights regimes that last until today. So it's been there for 20 years. So they intervene the economy. They impose all type of price controls, all kind of controls you can imagine, nationalize thousands of companies, domestic as well as international companies. And that was basically the action of that government. And for some time, it seemed it was working. And why did it work? It worked because for several years, oil prices and oil revenue, which is the resource Venezuela depends heavily on, was going up steadily, strongly. To give you an idea, when Chavez took power, the barrel of oil was at $10, and at one point it reached $100. So it was a tenfold increase in a relatively short period of time. So they were enjoying that tremendous windfall. But not only that, they took advantage of that temporary financial strength to borrow massively from international creditors. So they had that huge amount of resources never seen in the economic history of Venezuela. And they used it to do what? They staged a boom, consumer boom, a consumption boom that was, and this is critical to pay attention to, that was met with imports. Not with national production, but with imports. Why with imports? Because the national apparatus, the domestic economy was being destroyed. So there was money to pay for those imports. So a country that used to rely on 70% of the food that it consumes being produced domestically and 30% imported has ended up being in a completely opposite situation. 70% needs to come from overseas, only 30% produced internally. So for a few years, there was that boom, and everything seemed fine. Everybody seemed to be happy. Actually, there were many social programs that were basically handouts, and poverty, measured by income, went down. But of course, that party didn't last. It's not possible to sustain economic growth based on a single commodity, just one commodity, oil, and massive borrowing. At one point, creditors stopped lending you money. The oil price started to go down, but more importantly, because of corruption and because of mismanagement, the oil industry started to go down too. So oil production started to collapse in Venezuela. And I will show you in 2 minutes some slides for you to see it more clearly. So oil production started to go down. prices were going down. And of course, the international market, the financial market said no more money for Venezuela. At that point, there was not foreign exchange to continue to import the goods and services that were being imported and that no longer were being produced in Venezuela. At that point is when then a scarcity of medicine and foods started. On the other hand, the government not only did not have enough foreign exchange, the little it has was used to pay, it had to be to pay to service the foreign debt. It also started printing the national currency, the bolivars, and printed money as crazy, and so we got hyperinflation. And it's that hyperinflation was what has made so many Venezuelans so poor. So lack of foreign exchange, hyperinflation is the two factors that have created basically the current crisis. The party has been over for 4 years, and now I want to show you the slides to see the number of it. I'm sorry that the explanation of the crisis is taking longer than expected, but due to unforeseen factors. You see, this is the Venezuelan gross domestic product per capita collapse. There is no example in recent documented history anywhere in the world where this has happened. You see, the projection for the end of this year is that we are going to be close to 50% below where we were in 2012. This is GDP per capita, gross domestic product per capita. See what happens with oil. You see, the blue line is oil production. This is misgovernment. This is mismanagement of the oil industry. See how it was close to $3 million per barrel when Chavez took office, and it is now below $1.2 million barrels per day. It's close to getting close to 1.1. So see how the prices, the bars are the prices, went up. This is the, that time when the government was able to spend and to spend more and more money. See how we started from about 11, 10, and went up to 101, and then it declined. But not only prices were declining, more importantly, production was declining as well. That's a combination that, ended the abundance of foreign exchange for the country. And the government, see how at the beginning it was able to increase imports substantially. A country went from what you see there from 13 billion to 66 billion imports in a few years. So everything was being imported while the domestic economy was being destroyed. But then, as I explained, at one point there were not more dollars coming from the oil revenue, and then they had to start cutting imports dramatically to pay for the debt. And this is what explained shortage of everything in Venezuela: food, medicine, raw materials, for whatever companies are there, still there that could produce if they had that raw materials. See what happens with inflation. This is per month. These numbers are per month. To give you an idea, in case you don't know, here in the States you have like 2% per year, right? And this is the target for the Federal Reserve, is to reach 2% per year. We're having right now about 4% per day. And this is how it has, by year, how it has grown from 20% in 2012, projected now by the IMF, International Monetary Fund, to reach 1 million percent for this year. And this is, right now, it looks like a conservative number. Some estimate put the number at a higher figure, 1.4 million inflation. So this is what the minimum salary has become in Venezuela because of hyperinflation. So it's the lowest minimum salary in Venezuela. And I had to update it yesterday. I would have to update it possibly today again. So, but it's losing value as we speak. So this is per month, right? And this is not per hour. This is per month minimum salary in Venezuela. 70% of the population is of the workforce is in minimum salary. So 70% of the population is here, $7 per month. So this is what has happened with poverty in Venezuela. This is poverty measured by income. This is 2017. It's reached by then it had reached 87% of the population. Right now it's over 90. So practically everybody is under poverty. Is under the line of poverty in Venezuela. And let me show you, this is what happened with the industries in Venezuela. So they were decimated. This is why there is no local production either. So there is no capacity to import, and there is no much capacity to produce locally either. This is the number of industrial establishment in Venezuela, how it's evolved. And well, then just here there are some statistics, but relating to the health situation, which is part of what we are going to discuss now as part of the panel. But in a synthesis, what you have there is a complete collapse of practically everything. Infrastructure is collapsed because government didn't invest on keeping up that infrastructure in a good level of shape. So we have power shortages, blackouts happening every minute, every day, everywhere. Lack of running water becoming more and more frequent. Collapse of transport stations. So right now, about 70% of public transport is out of order. 70%. And then you have all those people, as a result of this situation, fleeing the country. Around 2.5 million people have left, and the projections is that this year, 2 more million may leave the country, going anywhere, even by foot. Desperate, because they don't have, in Venezuela, how to do with the most basic needs. So what I presented you was a very simple explanation of what got us here. And you have the numbers there. And now I hope that we can concentrate on the impact on the health sector, health of Venezuelan people, which is the main topic of this event. Thank you.
Thanks so much, Gerver. It might be a simple explanation, but it's a very powerful and clear one, and very disturbing data, of course. So I think I'd now like to ask the panelists to join us, and then I will introduce folks. So Diedrick, please, and actually, I'm going to ask you to be a working panelist. You need to pull that chair over as well.
Oh, you want to put that?
Yeah. We're going to need 5 chairs. So Diedrick Lohman is a friend and colleague from Human Rights Watch, and was the person we all owe a debt to because he reached out to us to talk about collaborating on these projects. Diedrick has been heading up the health program at Human Rights Watch for the last several years. He's been the acting director. Before that, he was the head of the Europe and Russia Bureau and the Central Asia Division, and he was Moscow office director for Human Rights Watch, which is a different day and a different panel, but still, no doubt, a very interesting one. And he's going to speak to us about the human rights dimensions of this situation. Directly to his right is Shannon Doocy. Shannon is an associate professor here. She's a member, faculty member in the Center for Humanitarian Health. She has real expertise in complex emergencies, humanitarian emergencies, and just looking at her bio recently, if you just hear this list of countries where she's worked recently and been active, you'll get a sense immediately of what a courageous and determined person she is. So Lebanon, Syria, Jordan, Pakistan, the Philippines, Democratic Republic of Congo, South Sudan, and Haiti. How's that? And then to her right is Kathleen Page. Kathleen is also an associate professor, but in the School of Medicine in the Infectious Disease Division. She is one of the founders and directors of Central Soul, which is an effort within the School of Medicine to do better outreach, clinical outreach to the Latino community in Baltimore. She is also a new member. She's one of the associate directors of our center, the Center for AIDS Research's Prevention Corps, and she also is the medical director of Baltimore City's STD clinics. So somebody who really works on the interface of health and rights, and we're going to start off with Diedrick. Please join me in welcoming them. And also, let me, just before you do that, let me also welcome the members of the advisory committee for the Center for Humanitarian Health. I know some of you are in the audience. I recognize some of you, so we're delighted to have you, CFAR directors. And our dean is back from Africa. Welcome, Ellen. Nice to have you here. Please join me in welcoming the panelists.
Thank you, Chris. Good morning, afternoon, everybody. Many thanks to Chris and Paul and everybody here at the Bloomberg School of Public Health for convening this event. As Chris mentioned, I work for Human Rights Watch, and I head up our Health and Human Rights program. About 3 years ago, our Venezuela expert in our Americas division approached me because she had been working on the human rights situation in Venezuela for many years, looking at the policies that the government was putting in place in order to basically abolish separation of power, establish almost complete control over government institutions as well as over civil society. But she had started noticing an increasing problem with access to basic medicines and medical supplies. And so she wanted to explore that issue. And this was before it had really become an issue that was highlighted in the media. And the kind of situations that she kept coming across was patients and families coming for surgery at a specialized hospital, a third kind of tertiary hospital, being asked by the hospital staff to go out and buy surgical gloves, antibiotics, all sorts of very basic medical products that really should be available in a tertiary hospital. And what patients and families were telling her was that they would go out and go to different pharmacies, and the pharmacies did not have these products. And so eventually the only option that remained for them was to go to a street vendor, often right across the street from the hospital, where they bought products of which they had no idea whether they were good quality. We started analyzing why is this happening, and realized that, as Gerver said, there's almost no production of pharmaceuticals or medical products in Venezuela, so everything had to be imported. But buying dollars was extremely difficult. And then the government imposed price controls on pharmaceutical and medical products, which meant that a for-profit pharmaceutical provider would have to buy at official exchange rates, which were completely out of whack with the street value of the currency, and then had to sell at prices that were set by the government. And so it became essentially impossible for anybody to import these medications and still turn a profit or even break even. And so that for that reason, a lot of both public institutions as well as pharmacies had run out of basic medications and medical supplies, whereas on the street, where price controls did not play a role, they were still available. And so we investigated that situation and published a few reports. And one of the things that we kept running into is the question of what is the impact that this is having on population health and on public health programs. And that's one of the reasons why we approached Chris. One of the things that we started seeing over and over again was that the government, for the government, the healthcare system was long a source of pride. Gerver mentioned the kind of handouts that were happening. Well, those happened in the healthcare arena. And so the deterioration of the healthcare system posed a real threat to the legitimacy of the government. And so what we started seeing was increasing efforts by the government to hide the extent of the humanitarian crisis that started emerging. And of course, having control over all branches of government, the government was in a very good position to actually to kind of hide what was happening. And we saw a number of different ways in which this was taking place. The first is just public denial, lying by the government about what is happening in the country. And for example, in May of this year, President Maduro said that everything you read about measles and diphtheria in Venezuela is a lie. We vaccinate the whole country for free. At the same time, the government was reporting to the Pan American Health Organization increasing numbers of measles outbreaks and diphtheria outbreaks. The Undersecretary of Health told the World Health Assembly also in May of this year, there is no humanitarian crisis. We guarantee access to basic medicines to vulnerable populations through distribution policies. And she also claimed there'd been a 50% reduction in malaria incidence, while at the same time, we saw the slide that you put up, at the same time, there were a lot of reports of very significant increases in malaria cases. The second way the government has tried to hide the crisis has been by stopping to publish epidemiological data. For decades, Venezuela published a weekly epidemiological bulletin, which provided updates on basically all notifiable diseases. That stopped in 2015, suddenly, and for a long period of time, these bulletins simply weren't being published. At the same time, we knew that the data was still being collected because PAHO was still receiving data on a certain number of vaccine-preventable diseases. We have also interviewed doctors at hospitals that were sentinel sites for specific conditions who told us, yes, we continue to collect all this information, we continue to report it. We have no idea what happens with it once we have reported it. And then in 2017, there was a health minister who was courageous, or maybe crazy enough, to publish a number of the bulletins over the previous year. And some of those, the bulletin for the last week of 2016 showed a 65% increase in maternal mortality compared to the same week the year before. A 30% increase in infant mortality compared to the year before. Maduro fired this health minister a few days later and replaced her with someone who declared that he was rabidly pro-Chavista. And the bulletins were removed from the Ministry of Health's website. A third way in which the government has tried to hide the situation has been through harassment of healthcare professionals who speak out on the situation. In January of this year, Maduro called healthcare providers who raised concerns about the humanitarian crisis bandits and traitors of the fatherland. We conducted, over the last few months, 25 interviews with clinicians at a variety of different hospitals across the country, all of whom spoke about censorship, who told us that they had been forbidden by the directors of their institutions to release any kind of statistics to outsiders. We've also documented cases of detentions of physicians who spoke to the media about the humanitarian situation. People have told us about forced retirements, demotions of healthcare workers who have publicly commented on the situation. And then finally, we have been documenting some cases of manipulation of medical records. It seems that clinicians at a lot of state public health institutions are being told not to record, in particular, childhood malnutrition cases on medical records, or if they do so, to record them at the very bottom of the medical record, so that in case of the death of a child, the death certificate reflects the first few medical conditions that the child had, but not childhood malnutrition, even though, of course, childhood malnutrition may very well be kind of the reason why the child developed other conditions that eventually killed them. We've heard reports of expulsion, or threats of expulsion of residents for speaking out or failing to make changes to the way they record conditions on medical records. And I wanted to close with a quote from one doctor who spoke to us. And I think, obviously there are a lot of doctors who are unwilling to speak to organizations like Human Rights Watch, but at the same time, there are a lot of physicians who are so concerned about the situation in the country that they take the risk of speaking out. In most cases, anonymously, because they do not want to be fired. And so one physician told us, "I wish to be working here, even in these horrible conditions, so I can help, so I can see the situation and share information. This is why I don't want you to mention me by name. I want to stay. If not, who will tell these stories? I cannot risk being fired." So that's the situation from our perspective, and I will leave it to Shannon and Kathleen to talk more about the epidemiological situation.
Thanks.
So I want to follow on with Diedrick's note on the situation related to acute malnutrition and food security. And really, as we saw from the economic deterioration in the country, you can imagine if the average minimum wage now is $8 a month, that most of the population is immensely food insecure. And so what we're seeing now is, in the most recent national surveys, more than 90% of households say they cannot afford food. And the majority are going to bed hungry and skipping meals every day. We know that in these types of situations that the status of children deteriorates the fastest. So very often we use the prevalence of acute malnutrition in children under 5 as a key indicator to determine whether or not it is or is not a food crisis. And in this case, because the government is actively suppressing data, there's no information available that can really help us to judge the severity of the crisis in Venezuela. So we don't have any national data. We're forced to kind of use key data that's coming out of a couple of organizations to kind of make some guesses. And so what we're seeing with some organizations that are reporting that have been monitoring acute malnutrition in various states across the country is that in many cases now more than 10 or 15% of children under the age of 5 are acutely malnourished. And when we compare this to the thresholds that are set by the World Health Organization, this meets the threshold for a food crisis or an emergency. It's not clear if this is the case throughout the country, and these aren't representative samples nationally. We know that, but this is just, trying to draw on the information that is available. Another really compelling piece of evidence that really suggests that we are moving towards nutrition crisis is looking at hospital admissions data. And we know that there's likely underreporting of acute malnutrition in hospital admissions due to a lot of the intimidation. And we know that in many cases, they've actually shut down acute malnutrition services for children as well. So what we're seeing is a big increase in the number of cases that are reported that are coming to hospitals, even within this context where where doctors are not freely able to report. And right now, in 2018, the data from at least half a dozen hospitals, between 17 and 40% of children that are admitted are acutely malnourished. And these numbers should be jumping off the page and frightening us. To give you a little bit of reference, what we see in other settings is in Europe, less than 1% of children that would come to a hospital are malnourished. And in the worst countries that we think of in terms of being at risk for famine, like Yemen and Ethiopia, the figures are typically around 20% or less. So this is a very, very alarming situation that we're seeing. The New York Times did a study looking at, in 2017, what was the impact of acute malnutrition, and they estimated that there were almost 3,000 cases in 2017, and we know 2018 is much worse, and at least 400 deaths. So we know the situation is, by now, deteriorated much, much more. And I had the privilege of going to the Colombia border with Human Rights Watch in July. And what we saw in talking to people there was that really food security, nutrition, and access to medicines were the primary drivers for people leaving the country. Colombia now has over 1 million Venezuelans. So they host more Venezuelans than any other country in the region, and you can imagine they're quite overburdened. And one of the largest increases that they were seeing in terms of their surveillance was increases in the number of Venezuelans coming across the border with acute malnutrition. Another kind of key driving factor was access to care during pregnancy. And so they were seeing a massive increase, not in the overall number of hospitalizations, but in particular in the number of women that were coming to give birth. So in the first half of 2018, in the one tertiary referral hospital that was accepting Venezuelans in the border area of Colombia, they had over 1,200 births. And they were seeing a lot higher numbers of complications due to inadequate prenatal care. And the complexity of the situation in Colombia just goes on. As you can imagine, if there's 1 million people, over 900,000 of them need humanitarian assistance. The humanitarian assistance dollars are just starting to come in and are in no way adequate. And their health system, all of their sort of social support services are really struggling to cope with the additional needs of the population. So with that, I will turn it over to Kathleen.
Okay. So let me comment a little bit about the health situation in Venezuela. Some of it has already been talked about, and then talk about what I saw when I went to the border with Brazil. This economic, political situation has really decimated the health system in Venezuela. There's an annual survey of 132 hospitals that is done by doctors in Venezuela and has been going on for a decade. The last one this year showed that over 80% of the hospitals had routinely had shortages of electricity and water and had to shut down for part of the day, except for emergency operations. 50% of the hospital beds and wards were not functioning properly, and 20% of all the ORs were not functioning at all. In addition, already in 2014, which was a lot before this current crisis, about a third of physicians, Venezuelan physicians, had left the country. And it is thought that many, many more have left at this point. So this is really, physicians who responded to the survey, over 90% said that they were working under the worst conditions that they had ever seen, and that their practice constantly challenged the human rights of the patients that they were taking care of. So in addition to the fact that the hospitals are not working, and as was mentioned before, patients are asked to buy everything. And we saw that when we're interviewing patients, people who, Venezuelans who had traveled to Brazil, from the very basic things, syringes, there's no syringes, there are no tests. Prenatal care, as Shannon described, is really non-existent. So this has had a massive effect within the country, of course. Unfortunately, because the data is suppressed, we don't really have any data from 2016 onwards, and we cannot count, we have no estimates of the death toll that this is causing, but clearly it's massive. What we do know, we have some hospitals that did share data with Human Rights Watch, and what they, in addition to seeing an enormous increase in vaccine-preventable diseases, malaria, the case fatality rates are 6 to 8 times higher for both infant diarrhea as well as malaria. The other issue that is important to me and important, I think, both for Venezuela and for public health in the region is HIV. The country really has, since 2017, access to antiretroviral therapy has been very intermittent. So most people report that they have had antiretroviral therapy interrupted at some point. And in April of 2018, antiretroviral therapy basically became not available. Some people could get it through the private sector, but even that became unaffordable, and it was certainly not available through the public sector. Bajo estimates is about 120,000 estimated Venezuelans with HIV. 80,000 or so were on antiretroviral therapy last year, and it's estimated almost all of them are out of antiretroviral therapy now. In addition to that, there is no testing for women who are pregnant. So new diagnoses, we don't know. They may seem like they have gone down because no one's testing anyone. And there are no condoms. So one of the camps that I went to in Brazil had a LGBT area, and the people there said that they had not seen condoms in 2 years. So there's no viral suppression, no condoms. The blood banks are not being tested for HIV. Malaria, you saw the rates have soared, and now we're seeing the impact of malaria as well as vaccine-preventable diseases, specifically measles and diphtheria in the neighboring countries. So malaria, the rise of malaria in Venezuela, which had eradicated malaria, by the way, in 1950, is the highest in the world. This year it's projected to have more than 400,000 cases. And the measles outbreak we started in 2017 has now spread to 5 countries in the region of whom they hadn't seen measles, or maybe all of them had seen 4 cases of measles in the last 3 years. There's now almost 2,000 cases, most of them in Brazil, and many of them affecting indigenous populations with a fairly high case fatality rate. So when I went to Brazil, it's actually interesting because compared to Colombia, many fewer Venezuelans are migrating to Brazil. So about 58,000 to 60,000 Venezuelans are thought to have crossed the border in the last year. This is, of course, a lot less than the million that have gone to Colombia. But the difference is that they're going to the north of Brazil, which is a super isolated area. So, we would see pregnant women with kids walking over to Brazil and then thinking that we're going to get to the next town and maybe to Manaus. Manaus is 800 kilometers away, so it's a very, very long walk. Boa Vista, which is the biggest town in the state, is 200 kilometers, and most people walk that distance. But the state is so small that Venezuelans are really overwhelming the system. So the hospitals now in Brazil are running out of basic things: antibiotics, syringes, gloves. The NICU the main NICU in the region is basically completely full, and they were having to borrow incubators from other states, partly because the Venezuelan women that are coming are so sick, they haven't had prenatal care, et cetera, so there's a lot more complications. And unfortunately, this situation, which is quite tense, coming to an area where there's not a lot of economic opportunity, where there is not enough healthcare for anyone really, has led to a lot of tension in the area, and you can see a rise in xenophobia. Many Venezuelans told us that a year ago they were welcome in the area, but now there's been some very ugly xenophobic attacks, in part because the area that they're moving to is really poor itself. And one of the things that the government has done is to build, refugee camps in the area, and I think there were some pictures that you guys may have seen. This is very unusual for South America, but it was a necessity because there's no place for people to live. Despite this, many people are still living on the street. All of them told us that they came to Brazil because of food insecurity. They had only eaten yuca, and if they lived in the coast, sardines for the last year, and for medications. But all of them also said that despite the xenophobic attacks, despite living in the street, despite the conditions in these refugee camps, which are not easy, they all were feeling better in Brazil than in Venezuela. So I think that speaks a lot to what the situation is like now.
Thank you, Kathleen. So we really do want to open this up for discussion and to hear from all of you, but perhaps before that, just one question for each of you to address. I think we've already answered my first question, which was going to be, is this a humanitarian crisis? I think that's a yes, even given the paucity of data. But really, the next question is, what can be done? Particularly because, of course, this government, as you so clearly pointed out, Diedrick, is colluding both in hiding the information and also in limiting the international response. But I think I'm sure the audience is now thoroughly concerned, as we all are, and let's think a little bit together about what responses might make a difference. I don't know if anybody wants to talk particularly about what the Global Fund to Fight AIDS, TB, and Malaria is doing.
I can say a few words about the Global Fund, but maybe the easiest thing to do right now, of course, is to provide humanitarian assistance to those Venezuelans who have left the country, because certainly the government of Colombia has been very forthcoming in both accepting Venezuelans and in trying to provide the necessary services for them. But obviously, with 1 million people having come in, and who knows how many more hundreds of thousands are going to follow, there is going to be a point where the Colombian government is going to need the support of the international community to meet the needs of these people. So I think that's kind of the easy part. Brazil is a more complicated situation. Kathleen already mentioned the situation in Roraima state in northern Brazil and how poor it is, and how there have been increasing challenges with xenophobia. That is only likely to get worse. As you know, Brazil had presidential elections a couple of weeks ago, and Jair Bolsonaro won, who is vehemently anti-immigrant. In the state of Roraima, a governor from Bolsonaro's party also, or the candidate for governor from his party also won, and so it's not really clear what is going to happen there. Obviously, Bolsonaro is very anti-Chavista, but he's also very anti-immigrant. And my colleagues, both in Brazil and our experts on Venezuela, believe that this is bad news for Venezuelans going into Brazil. The Global Fund. As many of you may know, the Global Fund normally does not provide funding for upper middle income countries, which Venezuela is still classified as an upper middle income country, even though that isn't really accurate anymore. And so there have been a lot of conversations with the Global Fund in order to impress on them the importance of making an exception for Venezuela. There now is a decision to make that exception, which dates back to I think September 24th of this year, so it's very recent. There's a commitment of $5 million, mostly for procurement of ARVs. And a little bit for civil society monitoring on the kind of the distribution of the ARVs. The PAHO Strategic Medicines Fund is going to be providing the medications. The Global Fund recognizes that this is only a drop in the bucket, and so a lot more will need to come in order to make sure that the, what did you say, 80,000 people who used to be on ARVs have access to their medicines again. But I think it's a very important first step because I think it's the first time that the Global Fund has made this kind of an exception. So a little bit of light there.
Indeed. Gerver, do you want to?
Yeah. Well, I think one of the first things that we have to do is to create awareness about the crisis. In that sense, this panel today is a step in the right direction, and this is why I, really thank you for doing this, because what's happening, what makes everything more difficult is what has been said here, is the government is denying the crisis. The government doesn't want to accept it, first because it would be an admission of failure. By the way, when it comes to health, as you said, health has been a particular, I should say, topic the government has been trying to show, success. But there is also another reason, is that the Cuban has been linked to that effort, quote unquote. So the Cubans from the very beginning had been, getting oil around 100,000 barrels per day in exchange for what is supposed to be, among other things, medical assistance. So to say that the health sector is in shambles is, in a way, saying, this hasn't worked. Mm-hmm. So to create awareness so that pressure can be put into the government to accept that there is that crisis and that help is needed in Venezuela. I think this is a main factor. You are dealing with someone that doesn't want to be helped. And as anyone knows, this is a major constraint. And it's a serious problem because it's not only that they are doing it for psychological reasons, no, I feel okay. No, it's because they have, in fact, reasons to feel afraid. This has become a very criminal state, mafia state, a hub of all type of criminal activities in Latin America. As you may know, many very high-ranking officials in Venezuela, including the vice president, has been leveled by the Treasury Department as international drug kingpins. So that's a difficult situation. But my second suggestion or recommendation would be to link with organizations that, even though there are all these problems, are there on the ground trying to do something. Civic society, or groups like Acción Solidaria, groups, doctors that, despite the situation, are trying to do their best to help those people who are in need. And to some extent, what's happening is that the government is turning a blind eye on them because they know that they need them, but they don't want to accept it. But the consequence of it is that something is done, but at very, very little. To give you an example of what is being done and what is needed, so PAHO, which is probably the organization that is making the largest effort in Venezuela, has increased his assistance to hospitals. They are moving from 11 to 18 hospitals. They are helping in different ways. Well, it is estimated to attend 80% of the population, which is the one that are requiring public health. You would need to have, in working condition, about 70 hospitals. So there is big gap there between 18 still and 70 hospitals, because those hospitals are practically, as I said, in shambles.
Shannon, I think you wanted to.
So a lot of people are asking too, well, what is the international community doing? And what's the international response looks like so far? And I think, there's a couple different UN agencies that launched big appeals earlier this year, and that, I think, really did help to increase the visibility and also increase the amount of attention to donors. So since the middle of 2018, we've seen large increases in big donors that typically would fund humanitarian crises, like the EU, for example, also increases in the US. But the challenge is we see these big donations that are beginning to roll in, but we don't necessarily know how much of the funding is going to Venezuela versus elsewhere in the region. So a lot of countries in the region need support for the response to the migrants. And we see good contributions going there, but less so in Venezuela. And a lot of the UN agencies really have their hands tied in Venezuela because they're there at the invitation of the government. They can only do what is acceptable, and they want to be able to remain. And so then we're seeing that what's left for what would be typically a very large humanitarian response is only actors that have been previously in country. So we're not seeing any of the international NGOs that would typically respond in a humanitarian setting be allowed to come in. And most of the humanitarian assistance that is happening through organizations that have been there already, but under the label of development funding, because anything that's humanitarian is just not palatable to the government.
I guess I would just add before we open it up that I think, of course, one of the questions we had is this a complex humanitarian emergency? Meaning, is there a political security component to this? It already, of course, is now a transnational problem because of malaria, childhood preventable diseases, and the HIV issues. But I think more importantly, this does meet, for me, from a human rights perspective, that threshold of a complex situation, because the root of it is governance. The root of it is politics. Ultimately, this is not an earthquake. This is not a tsunami, right? What has caused this problem is the governance. And so it's hard to imagine that humanitarian assistance, which is going to be vital and which the Venezuelan people urgently need, is also in some ways a stopgap. And the real change is going to have to be the changes in governance that begin to turn around these disastrous economic policies and right this country. And of course, there's the rub. Never, please.
Is there any evidence of popular uprising?
Gerver, you're
Well, people are very much afraid of repression. The government has become extremely efficient, and this is in part, I think, due to Cuban assistance on repressing, any expression of discontent. So there are many, protests every day around the country about everything, water, electricity, transport, whatever. But the opposition hasn't been able, or even people on the ground, they haven't been able to organize themselves in a way that, makes, put political pressure, against the government. Remember that most of the political leaders, opposition leaders, are either in exile, in prison. Some of them had been tortured. Very recently, one of them was just killed. He was thrown from a 10th floor. It's something similar to what happened in Saudi Arabia with Khashoggi, was it? Something like that, an assassination in Venezuela. So, and we were not used to that. People in Venezuela were not used to that level of repression, that they would go to the street to protest and they would be, intimidated and hit and assaulted. So we are dealing with that problem.
But the things that you're talking about are, in fact, I think you used the word stopgap. Where's the real solution?
Well, we have Steve Morrison, who's usually thoughtful on those real solutions. I'll get to you in a moment, sir.
Thank you all for these presentations. They were comment on the internal situation and one on the external. On the internal, PAHO has really distinguished itself in this period. I mean, the leadership, the number of missions, I forget, just dozens of very quiet missions, and they put together this strategic plan for trying to cover the gaps. But I think, as you point out, until the actual crisis surrounding Maduro is somehow resolved one way or the other, I just don't see an opportunity to move forward, and that the situation will, for all the reasons that you've enumerated, right? There's the Global Fund putting $5 million into a $200 million plan doesn't get you very far.
Yep.
And the donor appeals have shown a little bit of uptick, but not much. I mean, donors are scared off by this situation because they realize access, infrastructure, control over end use, all of those things don't exist. And they don't have reliable partners, they don't have confidence the dollars will translate into non-diverted outcomes, et cetera, et cetera. So I think we're looking at, a doubling of the continued very steep historic levels of out-migration until the central crisis around Maduro somehow is resolved. On the external side, I think it's been remarkable up to now, the generosity of the Colombians and the Peruvians in particular. And quietly, the U.S. asylum cases have been very high and very important also. But there's a continued high uncertainty as to what happens here in the U.S. on future intake of folks. And I agree with you that if you go from 2.5 to 4.5 or 5 million, what that means for the burden on the region becomes strategic and becomes destabilizing. And I would expect you would see some sort of higher level of political response. Up to now, the fragmentation in the region has really gotten in the way of any kind of coherent regional response to something that's unprecedented and is spilling into their backyards obviously at levels. And the political transitions don't help. The political transition in Colombia, Brazil, as you referenced, Brazil's not taking much in. I think the bigger question is Colombia, Peru, U.S. Thank you.
Please.
Where do the international health regulations intersect with any of this, or is that just, politics?
We have to make sure.
Yes. Anybody want to take that, or Court, your?
I was going to ask a question, not a comment.
Okay. All right.
Well, you have.
So, how do the international health regulations play into any of this? We saw that in the Ebola response, that was a prominent instrument since they've been updated with a little more teeth recently. But I haven't heard anybody mention that, or whether or not that's something that PAHO can do on its own for the region, or it has to go to Geneva. But where do they play here?
I don't know, Paul, you want to? You have an expert on that.
No, not so much. But they don't for the moment, because it's primarily dealing with the international health regulations with diseases. And the level of public health care of international concern for a disease right now is not there, sadly. So I don't think this will come into play, at least for the moment. Perhaps if you get polio or something else, that may change. But right now, I don't think we're talking malaria and diphtheria that will occur.
Oh, I was just wondering, even though like more than 2 million people have left the country, that's still a lot of people that are in the country. And with the complete collapse of the currency and the infrastructure, how are they getting by at all? I mean, clearly a lot of them aren't, because there's so many people that are starving. But like, how are they continuing to even like hold together at all? What are they doing?
So I have not been to Venezuela, so I can tell you what people told us from the other side, and maybe someone else can comment. So, people really are scavenging for food. It's gone, and people who were, many of the people we talked to were people who had very middle income, middle income jobs, were now scavenging for food, praying that they won't get sick, because that's sort of because of death. the kids, most people are not sending, many people are not sending their kids to school because they used to get lunch in school, but now they're not getting lunch. And just what we heard is that the trip to the school just was an expenditure, either because of cost or just because of energy, that they were not willing to take their kids to school. So, you know, that was only one little glimpse, but I like you, I'm increasing, I mean, the 2 million people that left are maybe the lucky ones, you know, the ones that are there. I'm not sure how they're surviving, but you probably have been to Venezuela.
No, I was there recently. Just want to add to this complexity one element we haven't mentioned. Venezuela has one of the highest crime rates in the world. So, for example, you have like 120, 150 homicides per 100,000 population. Here, maybe, I don't know, 20. It means that, for example, in Caracas, in Venezuela, at 7 o'clock in the evening, streets are empty. Nobody is out. And regarding to your question, how people move from one place to another? Well, one of the things you see is that there is not much traffic now. Caracas used to be a city full of traffic, congestion everywhere. Now there is no traffic. Cars are, most of them, are out of service. And people who use public transportation, very often they either have to walk long distances to go to a job where they get paid. Sometimes they go to work just for the food they get there. And very often they are transported in, trucks. Trucks are used for carrying materials, animals, all type of transportation are being used that is not intended for that purpose.
So partly a comment, partly a question. You use the word refugees and migrants, and it seems to me that we might agree this is a humanitarian crisis writ large. The question is, when people move across an international border, what do you call them? And who can you call upon in the humanitarian community to protect them? And this is where I think we're facing a dilemma. If you would say they're all refugees, they've all had their right to health or adequate standard of living violated, give them full asylum and protection, either temporary protection or even resettlement, I don't think even the refugee field would say we're comfortable with that. If you say they're all migrants, food migrants, economic migrants, just give them food, shelter, water, and let them go home again, or maybe even deport them, nobody would agree that that's a satisfactory solution either. So are they what people often call now crisis migrants, large-scale vulnerable migrants in migration, displacement, overlapping with refugees? We might say yes, but then how do you bring to bear these different mechanisms, UNHCR, IOM, and others, to say who needs protection on a more permanent basis, who can be assisted temporarily and maybe even assisted return? Can you send people back without their consent or voluntary will? Even in the face, if it's back to crisis that is in the worst form, criminal, right? Criminal governance. Can you hold this government accountable as a violator of human rights? And what sort of protections does that actually translate to for the people who are externally displaced?
So one thing to bring up, and there may be others here who know more about this, but is the Cartagena Convention, which South America, most South America, 15 South American, Latin American countries have adopted this Cartagena Convention, where refugees not only thought of because of persecution for gender, religious beliefs, political ideology, but also for massive disruption in the public order. So based on that little clause, that actually does make most of the Venezuelan migrants potentially refugees. Now, not all the countries have adopted this as law and legislation, and so there's still, I think, some debate in this area. But that, at least in Brazil, for example, unless something changes, that is how things are being interpreted, and Venezuelans are able to process as refugee status.
Yeah, there's a question in the back.
So two questions. One is,
Just one question. We're running out of time.
okay, so I haven't heard a lot of talk about social factors that are influencing this, and the gentleman over there also mentioned sort of some of this, but there's also a lot of issues between Venezuela, a lot of support from China and Russia that are playing into this in terms of investment, foreign investment, and debt, and contributing to the debt crisis. And so that also relates to the fragmentation of the regional partners and the U.S.'s role and all of that. And I'm wondering if you can talk a little bit about that, because basically as long as they have that kind of support, regime change is going to be really difficult to actuate.
Yeah, that's a very important point. Russia, China, now Turkey, at one point Iran, had been supporters of the Venezuelan regime. And some others, Syria, even this guy from North Korea, he has spoken well about the regime in Venezuela. So, and they have provided some type of support, or a lot of support, not to say intelligence, which have come mostly from Cuba. By the way, all this use of media to manipulate public opinion, you can imagine, with the assistance from the government, how it has been done in Venezuela. But one of the things that the international community had to do, or would have to do in Latin America especially, is to talk to Russia and to Cuba and to China. And those countries are trying to make inroads, China and particularly in Latin America. So they have to tell them, this is for us unacceptable, what you are doing in Venezuela, because this is our region, right? If you want to do business in Latin America, well, you have to behave according to certain rules. For us, this is unacceptable. So I think you are absolutely right. Those are critical elements of the equation here.
I had a question. I had a question about the faith-based organizations in Venezuela. They've always been very effective in many countries from the humanitarian side, and many times have had a governance influence as well. So what are the potentials of employing these avenues to reach the people in need that are still in the country?
Faith-based?
Faith-based.
Well, the government has practically declared war against the church in Venezuela. About 85% of the people are in Venezuela Catholics. So they have, tried to undermine in all possible ways members of the church and to discredit them. They've been very active. They've been very vocal. They have gone very far in terms of criticizing, denouncing, trying to do things. But the government has been, also actively working against them. So they have been limited to.
Can I just one little? Sure. I think actually some of the best data that we have on malnutrition in Venezuela comes from Caritas, because they've been working in a number of different places with children and have been, doing surveys in some of those locations. The problem is with scaling up. Everybody that we've spoken to who is in one way or another involved in providing humanitarian assistance in Venezuela says that essentially their continued ability to do that work is highly tenuous. And the relations with the government are very complicated. Shipments of new materials are delayed, sometimes confiscated, and so kind of the environment isn't one in which scaling up is very is really possible.
Well, I'm afraid we've run out of time. I think this has been really a wonderful, disturbing, challenging panel and presentations. I want to thank all of you, and I want to thank all of you for attending. We heard that one of the things that really matters and makes a difference is paying attention and advocacy and getting the word out there. So that's part of what we try and do at the school. And please join me in thanking these wonderful